members. There we go, we got that recording going. A little bit about me. I'm the current chair of the IMD, and prior to serving in this role, I served as the secretary of the IMD for 2 terms. If you may recall, 1 term is 2 years, 2 terms would be 4 years. So I have been around as your IMD EC member for the past 4 years, and I'm so excited to be serving as your chair. Thank you to everyone who participated in our elections next year, and we hope that we have a great turnout in our elections coming up this year. I'm a pediatric nurse by training. I've kind of done every critical care area. I have an MSN as well as an MBA. I got into hospital leadership, and I now work for Texas Medicaid and CHIP Services. So I am in Austin, Texas in the central time zone. So I will say good evening to everyone who's a little bit later, and good afternoon to everyone who is a little bit earlier. Supporting me in the executive committee are our members. Lori Marino is serving as our vice chair. Dr. Marino has had several elected offices with the West Virginia Nurses Association, including president, APRN Congress chair, and membership assembly delegate. During these years of service, the association figured prominently in modernizing scope of practice laws, increasing membership, and building diversity in the leadership team. Dr. Marino is completing her first term on ANA's nomination and election committee. At the current time, the role of secretary is vacant. We are looking at making an appointment to fill the unexpired term, which would last until June 30th. And so we will just bring you more information as is ready for the appointment of that secretary position. Next slide, please. Also on our executive committee is Sarah Roberts. She's our member at large and also a membership assembly representative. Her nursing career began as a nurse's aide, and now Dr. Roberts, she continued to continue her education to become an RN and spent the first years of her nursing career at the bedside in critical care. After deciding to move into leadership as a cardiopulmonary director, she completed an MSN in nursing management and leadership. She was promoted to a position of National Director of Clinical Development in 2014 and completed her DNP in executive leadership in 2017. She is an ANCC board certified nurse executive. Next, we have Jill Ellis, who is our other member at large and membership assembly representative. Jill has been an RN for 40 years. In her nursing role, she has worked at the bedside in the NICU and in pediatrics. She's worked for several large organizations with a comprehensive nursing department. 20 years into nursing, she went back to school for her BSN and then progressed on for her Master of Health Services Administration. She has served as a leader in nursing at the operations level and advanced in her career. I am so sorry. There was just an Amber Alert that went off on my phone. Advanced her career as a director of nursing for a community hospital. 30 years as a nurse and nurse leader, Jill became a healthcare coach and consulting for nursing leaders across the country. And last but not least, we have Jeffrey Bevins. Jeffrey is our member at large and alternate member assembly representative. He has 25 years of experience in nursing practice, with the past 15 years serving as an APRN and nurse educator. Jeff's clinical interests include primary care and emergency nursing. Academically, Jeff enjoys teaching graduate students who are seeking advanced practice roles. Thank you to all of the executive committee members for your willingness to serve the IMD. Next slide, please. And the IMD cannot exist without the support of our wonderful ANA staff. We have Tina McRae Phelps, who's our Director of Constituent Relations and Membership Support. We have Shivangi Bhatt as the Senior Program Specialist, and Brian Pinder, who's our Program Manager, Membership Marketing Program Specialist. And at this time, I'd like to just take a moment to have all the IMD EC and the staff supporting the IMD to come on camera and give a little wave. All right, thanks everyone. All right, go ahead, next slide. So a little bit about the IMD. We in the IMDEC have come to understand that there may be a lack of clarity about the IMD, also known as ANA only members. Let's take a moment to discuss this. The IMD of the ANA was established by an amendment to the ANA bylaws on June 26, 2003. The purpose of the IMD shall be to provide the organizational structure to permit ANA individual members, also known as those who elect to join ANA directly at the national level, to participate in the governance of the IMD and ANA, as well as in the programmatic work of the ANA as expressed in the ANA bylaws. Under our operating policies and procedures, the IMD Executive Committee is comprised of 3 IMD officers, a chairperson, a vice chairperson, and a secretary, 2 members at large / member assembly representatives, and the term of office for all of these positions are 2 years, and it is only allowed for a member to serve no more than 2 consecutive terms in that same office. And to make that very simple, I like to repeat what Tina has reminded me, is that the IMD is the ANA. We can sum that slide up very quickly. Let's go to the next slide. All right, perfect. So what do we do? Based on the IMD's purpose, as outlined in our operating policies and procedures, our core responsibilities are to foster engagement within and among IMD members, foster awareness of ANA's initiatives, policies, programs, and offerings, actively participate in the governance proceedings of the ANA, speaking to IMD decisions based on ANA-only members' interests, and acknowledge communications necessary with the ANA, be involved in programmatic work and opportunities, and give voice to the ANA. Some of the examples of how we fulfill these roles and responsibilities include congratulating IMD members engaged in work or recognized for achievement within the ANA, participating in membership assembly as well as leadership council, reviewing the IMD operating guidelines to ensure clarity and conformity of ANA bylaws, which we are asking for your participation today, participating in disseminating messages to IMD members, conducting yearly elections, ensuring engagement and awareness surveys, and hosting an annual meeting. Virtually, of course, because we are spread out all over. And so with that, let's go to the next slide. I would love to hear from those of you who are on the call today. I'm so happy that you're here on the call because we don't always get to interact with people as directly as we do in this format. And so I am posing this question to you all. And as we've all learned to work in a hybrid environment over the past almost 3 years now, you have lots of options for answering this question. So if you would like to answer, please feel free to come off mute or type in the chat, or if you want to think of your answer later, and I have a cat who is trying to get on camera as well. If you want to think of your answer later and send it to me so I can read it later, feel free to email imdchair@ana.org. So my question to you all is, as an ANA only member, how have you been engaged, and or how would you like to be engaged in ANA? And as you're thinking of your questions, I am going to ask the ANA staff to help me because at this time I cannot see the chat and I can't see any raised hands. So if you guys can help me out if you see any questions coming in.
So Emily, yes, we have a few coming in the chat. So the first one is, are there any specific criteria for IMD membership. It's a question. Would you like to handle that, Chair Broca? Would you like for me to?
I think you would have the exact language necessary, Tina, to answer that question. So go ahead.
Not a problem. So it's a very simple answer, and all of you are already meeting that criteria. You are members of ANA. You have decided or determined to be affiliated with ANA through ANA only membership. So the annual dues that you pay have qualified you as ANA only members. And the IMD is the representative voice in governance for you. So you have your IMD executive committee that's working on your behalf and serving as membership assembly representatives, for example, in helping to vote for particular policies and positions that the ANA is taking. So you've already met the criteria. You are an RN, you are a registered nurse within the United States, and you have qualified for membership, and that your choice has been ANA only membership. Few bits of feedback. New IMD member due to CMA separation from ANA would like to be a member of a new CSNA to ANA for Ohio. Welcome. Thank you for joining us, for continuing your membership with us. Stay tuned as plans unfold related to the next steps in Ohio. Lots of other feedback new to IMD. One of the displaced Ohio people, we're glad that you've continued to make a home here with ANA. Another new to quite a few. We have 1, 2, 3, 4, 5 more individuals that are here. They're new ANA only members based on the disaffiliation with Ohio. Scanning. Nope. All of the other comments, Lori, are individuals that are introducing themselves as being new to ANA based on their new status due to the disaffiliation in Ohio.
Well, welcome to you all from Ohio. Welcome to the IMD. Our membership might be a little bit different since we are not a specific state association. So we kind of cover everything. And like I mentioned before, the way that I like to explain this to people who ask is that the IMD is the ANA. So anytime there is anything that comes out from the ANA that really impacts us, and we get to have maybe not a 30,000 foot view, maybe we have the 50,000 foot view because we really encompass kind of everyone. In terms of our membership, I think we have a representative from almost every state. So there are many states as well as nurses living abroad who choose to be part of the IMD. So we are, and the ANA staff can help me, I think we are the 4th largest group by membership. So we're a large bunch, and we kind of cover a little bit of everything. So I'm glad that you are, that everyone is joining from wherever you are joining this afternoon. I am going to eye on time, and I think we need to go to the next slide.
Before we do, we did have a raised hand from Rita Munley Gallagher. Rita, did you want to come off mute? Did you have a comment or a question?
I just wanted to say welcome to all the newly disaffiliated people. I got disaffiliated from Michigan decades ago, and I've had the opportunity to work with the independent member division actually since its inception. And what it does, in my opinion, is provide those of us who don't have the in-state support of a CSNA the opportunity to have our voice heard by ANA. And I think it's a marvelous opportunity, and have been very pleased with my involvement over the years. Thank you.
And Emily, that is the only raised hand, and there's lots of welcoming remarks in the chat at current to all of our new Ohio family.
All right, awesome. Thank you, Rita, for sharing your experience. And for those who may not be aware, Rita was a former member of our IMD Executive Committee. So thank you for your service then as well. We are going to move on to a quick review of our current IMD policies and procedure. The primary area of business today is to review and conduct voting for proposed changes to the IMD operating policies and procedures, which is our governing document, as tied to the ANA bylaws. The operating guidelines state, specifically Article 9, 9 or 11. Come on, you got to help me with these Roman numerals.
Article 9.
I'm sorry.
Article
I thought
9.
that was a 9. Article 9 is any amendment of these IMD operating policies and procedures may be accomplished through a majority vote of the participating members during a properly noticed IMD membership meeting. That's today. Any proposed amendment must have been reviewed by the ANA Committee on Bylaws for conformity with ANA bylaws, who in turn will make a recommendation to the ANA Board of Directors regarding approval. Accordingly, we are before you today to review the high-level proposed changes to our document, clarify any questions, and provide instructions for how voting will occur. Before we begin, it is important to note that there are 2 areas for which it is necessary to capture your vote. One is the proposed changes generally for the proposed amendments to the document as stated. The second, and one that must be voted upon first, is to seek approval to a proviso to allow us to elect a member-at-large / membership assembly representative each year instead of the current provision of every 2 years. So let's take a closer look. Next slide, please. I'll pause and just say, for those of you who are new to the IMD, as I previously mentioned, the IMD Executive Committee has 2 member-at-large positions. And just so that's clear, sometimes we need to hear things a couple of times. Those member-at-large positions, the way things currently are, is they are voted into their positions at the same time. So we're looking to split that. That's the quick summary. The proviso to be considered during this meeting applies to proposed changes to Article 6, Section C, 1, 2, and 3, that outline proposed changes to the member-at-large positions on the IMD Executive Committee. Their terms, the duration of time for which serves. This proviso would allow for the IMD to begin staggering the terms of office for these positions, beginning with the 2023 IMD election. I'm now going to read the proviso in case anyone has called in and you cannot see the slide. To comport with these amended operating policies and procedures, the term of the member-at-large serving as the second representative elected in 2021 will be extended by lot until 2024. Beginning with the 2023 election cycle, 1 member-at-large will be elected each year. End of proviso. In 2022, the IMD Executive Committee discussed and deliberated the pros and cons for having staggered elections for the membership assembly representatives. By way of information, the ANA Membership Assembly is the governing and official voting body of the ANA. It identifies and discusses issues of concern to members and provides direction to the ANA Board of Directors. One of the key responsibilities of the ANA Membership Assembly is to determine policies and positions for the association. The meeting of the ANA Membership Assembly provides a forum for discussion of critical nursing practice and policy issues and input from a cross-section of nursing leaders. The ANA Membership Assembly is comprised of ANA members who are representatives from ANA's constituent member organizations, also known as CSNAs, the IMD, affiliated organizations, and members of the ANA Board of Directors. Serving as part of the governing body with the responsibility to elect and send membership assembly representatives to the membership assembly meeting, the IMD discussed how having continuity from meeting to meeting is important to help maintain familiarity between meetings and the representatives sent each year. At current, both elective MA representatives are elected together in the odd years, which means that every 2 years, both roll off unless they run for re-election, which creates a circumstance of new individuals being elected at once who may or may not have requisite familiarity with the work of and voting responsibilities of member assembly representatives. This proviso seeks to put in place, beginning this year with the upcoming election, the opportunity to extend one of the current MA representatives by 1 year and elect the other in this current year. And then beginning in 2024, elect one each year thereafter. Before we proceed with the high level of the other proposed changes for the operating policies and procedures, I want to pause again for any questions. So feel free to come off mute, raise your hand, or put any questions you have in the chat. And again, I am going to ask Tina and Shivangi to help.
Chair Roca, at this time, we don't have any hands raised at the moment, and we do not have any comments just yet in the chat. Pause for a few moments. Chair Roca, seeing no hands raised or any comments in the chat, I think you're clear to proceed.
All right, let's go to next slide then. All right, so now on to our business item number 2, which is the proposed amendments to the IMD policies and procedures. On December 21st, 2022, you received a notice of proposed changes to the IMD operating policies and procedures. A periodic review of this document is a requirement of the IMD, as well as any CSNA, to ensure harmony with the ANA bylaws. Accordingly, in addition to seeking a review by the ANA Committee on Bylaws for a review of proposed amendments to the Membership Assembly Representatives election cycle discussed previously, a requisite review for harmony was also conducted. You were provided access to both the redlined and clean versions of the document for your review. Considering the availability provided to review changes in their entirety, next week we will review a high-level summary of the proposed changes. And once we send out the slides, you'll see that this slide has links to both of those documents. Let's go to the next slide. Okay, so here's what we are proposing to change to our IMD operating policies and procedures. The first item was just to fix some grammar throughout. This document's been around for a while, but somehow there's some grammatical errors still in it. So simple fixes to grammatical errors. Fixes to address clarity and consistency throughout the document. So no substance changes there, just making sure that what is meant to be said is said. 3 includes requirement to meet membership assembly representatives and alternates as needed. 4, expansion of opportunities for membership assembly representatives to participate in other calls for appointments for ANA Board of Directors committees. 5, provides for special meetings, if necessary, of the IMD Executive Committee and or the IMD membership and the required notification period of such meetings. And 6, creates a provision for non-substantive changes or amendments to the IMD policies and procedures to be made and not require a review by the ANA Committee on Bylaws or a vote of the IMD members, which basically just means in the coming years, if we continue to find any kind of grammatical formatting or cleanup things, we wouldn't have to convene an entire meeting just to tell everybody that that's what we're doing. So next slide is a Q&A to bring up, give everyone an option to ask some questions, but I think it's actually helpful if we just leave it on the one prior slide that has the proposed changes in case anyone needs that as a reference. Yeah, there we go. And again, I will ask the ANA staff if there are any questions, raised hands, anything in the chat box.
Chair Roca, there are no raised hands right now, but there is a question or in the chat, and it is, I'm looking at the bylaws. Can you reference what part of the bylaws you're talking about? I guess for clarity, it would be important to understand if the person is looking at the ANA bylaws or if you're looking at the IMD operating policies and procedures, which are two different documents.
Yep, so go ahead if that was your question. Feel free to come off mute or put your clarification in the chat.
Standing by, Chair Roca, to see if the individual is
Typing.
typing. ANA
Okay.
bylaws, I do not have operating policies and procedures. So I can take this one. So the this is related to the IMD's operating policies and procedures. The IMD does not operate under the bylaws. Based on the previous comment by Chair Roca that ANA only members are ANA, so we are all governed by the ANA bylaws. But we do have operating policies and procedures for which we are able to help organize ourselves around the work. Access to those policies and procedures were communicated via the email, the notice to meeting, December 21st. They were also referenced here in a couple slides previously related to where they were linked in both the red line and clean version. In the ballot that Chair Roca will share with you in a moment, there will also be links in your ballot if you do need to reference those documents again. But they were previously communicated, and they are also available on the IMD page on Nursing World. So if you go to nursingworld.org, you click on the membership tab, you click on the individual member division, you log in, and both documents are linked there as well. Chair Roca, I believe that satisfied the question. There was a thank you, and the individual will take a look at them.
Okay, perfect. Well, let's go forward 2 slides now. There we go. This also might help with some clarification, and it's definitely reinforcing what Tina just mentioned. You will, after this meeting, receive voting instructions. So keep an eye out in your email for voting instructions. You are going to receive a link to vote. That link is going to have 2 questions. One question is going to be able to vote yes or no for the proviso, and the other is to vote yes or no on the proposed changes to the IMD operating policies and procedures. You will cast only 1 ballot, so 1 vote for each question. Do not share your link with others. It's just for you. Voting will open after, I believe after this meeting, and correct me if I'm wrong. I think it opens after this meeting, and it will remain open for an entire week. So you can sit there and have a cup of coffee or tea and review and read all of that red line document in detail if you so choose to do so. Because you have all the way until Thursday, February 2nd to cast your vote. And as always, if you have any questions, you can send them to imdchair@ana.org, and we will be able to get back to you with your questions. All right, so now we have officially covered our business items of the meeting. We are going to turn our floor over to Oriana Bodette, who is our ANA VP of Innovation. As the ANA VP of Nursing Innovation, Dr. Bodette works across the ANA enterprise. Sorry, I did actually see a chat question come in, so let me pause for just a moment. It like flashed up on my screen. Tina, did you want to address that question that just came in?
Sure. It is a majority of the IMD members that are present and voting based on this meeting.
Awesome. I knew that was a quick answer. I'm so lucky that that flashed up on the screen. Okay, so back to Ori. Ori, I'm so excited. You guys are going to love Ori if you haven't met her before. She works across ANA to support the development of nurses and healthcare innovation. This starts with unlocking the exclusivity of the innovation process. Her goal is to support nurses to build and lead innovation initiatives across every aspect of the healthcare ecosystem. Dr. Baudet has been leading innovative change for more than 15 years through strategic, operational, and change management work for nurses, nursing executives, and health systems, looking to innovate across their organizations nationally. Most recently, she served as Vice President of Transformation with ARA Advisors, where she led strategic change management and business development for national health system clients focused on business, technology, and care delivery solutions. Dr. Baudet completed her DNP with an emphasis in healthcare innovation and design from the University of Minnesota School of Nursing. And I'd like to say that I enjoy getting to work with Ori as part of the Innovation Advisory Committee. She and the rest of the nurses on the Innovation Advisory Committee selected, I think there's close to like 80 of us, and you can correct me if I'm wrong, to work on subcommittees, really looking at innovating a whole bunch of different topics in nursing. So specifically, I sit on the social determinants of health and equity, I think, is in there. We have like one of the longer names, and we get to work on things really together that have to look at innovating in that space, and along with helping any nurse who is interested in getting into this space. I mentioned earlier, I work for Medicaid here in the state of Texas, which, it's just another area of nursing that nurses can work in. We can work really anywhere. We have such a great skill set. And so I've really enjoyed my work and getting to meet the other, like nursing nerds that we are, and we get to all nerd out together on social determinants of health. So I am so happy that Ori gets to present with us this afternoon, and she is going to take over the screen. And then once she is finished, then I'll come back and wrap up our meeting this afternoon. So welcome, Ori.
Thanks so much. And Emily is amazing. So Emily sits, just like she said, she is an integral part of our innovation advisory committee focused on policy determinants of health. And the work that team has put into those resources is incredible. So I cannot thank her enough. I just want to make sure that slide came up on your end. Emily, can you see it on your end? I just want to make sure we're good to go. All right.
Yep, I can see your slide.
Sounds good. Well, thank you so much for inviting me here. And, I love the fact, because in the innovation space, we are looking at innovation across the country and where are nurses doing. And this group is that representation of nurses who are literally could be anywhere in the United States or a Commonwealth or a territory. And so I think that we have a lot of synergy in that space, and because we're looking for content and information and stories about nurses who are leading this kind of work. And so I just want to say thank you to all of you for joining tonight. And when we think about, nurses as innovators, I think a lot of nurses, some nurses would say, yes, right, that's me. I'm an innovator. They identify and recognize that. But for a lot of nurses, they may think about it a little bit differently. They may say, I'm an entrepreneur, right? I've started a business. I'm coaching. I've, created something. We have nurses who might say they're an entrepreneur because they're leading or driving change within an organization, whether that's a health system or public health or in the community. We have nurses who are, would maybe identify as researchers, and, they're creating new science for the profession. We have some nurses who would call themselves scientists, because I am developing new science for the profession. I think a lot of nurses, if you asked as a whole, and even just quick show of hands for those in attendance, how many of you have hacked something, right? Something didn't work in a shift, and so maybe it was a piece of equipment, or it was a solution you were trying to figure out for a patient or family. But nurses are constantly kind of on the fly designing solutions to make things work, and that really falls into that. For a lot of nurses are like, yeah, we'll fix it, right? We'll figure it out. All I need is a piece of tape and a straw and a tongue depressor, and right, we're good to go. And it's that willingness to kind of, again, problem solve in the moment. But it doesn't matter what title you use. When nurses are leading this kind of work, they are innovating. And so trying to help nurses recognize this rich part of our history, which is what nursing has always done, and we have this rich history of, is actually something that's happening today. And so to all of you, my name is Oriana, and just an easy way to remember me is, like Emily said, I'm Ori and I work at ANA. It's probably the best way to remember my name. I'll answer to either, but in the innovation space, I definitely live in a world of Post-it notes, whether those are in person or virtual. But innovation is really about this space where we're focused on growth and choosing not to be stuck. And I think about this quote, and it's, growth is painful, change is painful, but nothing is as painful as staying stuck where you don't belong, right? And I think, how many of you, even just in the chat, have worked with someone who is stuck, right? What that, and I'd be curious, what does that feel like to work with somebody who's stuck? I can't see the chat, but if there are any words there, or you feel comfortable taking yourself off mute to share that, what does that feel like to work with somebody who's stuck?
Ori, a couple of comments are coming in. Frustrating, miserable, depressing. Keep it coming. The group moving forward.
Right? I was like, this is a universal experience, and it's tangible, and you remember it, and it's right. It's kind of like that Maya Angelou quote, you may not remember what people said, but you remember how they made you feel. And people who are stuck, that resistance to change, to trying new things, to, we've done that before. Why are you bothering? And that is really that pushback against, trying something new, evolving, becoming better, and how, all of the sentiments that you guys have shared, how very real that is. And we take, we know when we've hit that kind of resistance in another individual. And, something to think about is, in the United States, right, there are 4.4 million nurses, and that number just changed. So really, my math is just a smidge off here, but it's real close. For every 76 to 77 people in the United States, one of those people is a nurse. And when you think about the scale of our profession across the United States, it's broad, right? We, because of the size of our profession, we are, and you think about how many people a single nurse may interact with in a single day, right? A single shift. And, not only a patient or, an individual or families or, community groups, it doesn't matter, right? The sheer impact of who we're able to influence, to support, to guide, to educate, the scale with which nurses can bring about change in the United States around health, around healthcare is phenomenal when we think about just again, that size of our profession. There are more nurses in the United States than any other profession. There are more nurses in healthcare leadership than any other profession. And so when we think about how do we activate all of these nurses to really start leading, recognizing innovation, leading and driving positive change, and supporting them to drive positive change within the systems that they're working, all of the opportunity in that space. In the innovation space, we're also looking to really build and grow the research around innovation and the science of innovation. This was a body of work that we led collaboratively with J&J and AONL. And what we did is we started with a kind of a quantitative assessment, market assessment around the perceptions of nurses, nursing students, advanced practice nurses, and different healthcare professionals, and how did nursing rank against that? And we added in questions for the Future of Nursing report, and then we followed that up with qualitative interviews with subject matter experts around 3 different areas. And all of that developed into the Accelerating Nursing Transforming Healthcare research. But there is a lot of research, right? There's a lot of conversation about nursing and what's happening in nursing. How has nursing been impacted by the pandemic? It's very hard to tell right now, right? We're still in the thick of it. This is ongoing. But as we looked at some of that early research, the Future of Nursing 2020-2030 report, there is a tri-council that comes together. It's called TRI. There, as you can see on your screen, there are actually 5 organizations that are a part of it, but the TRI stands for Education, Practice, and Regulation. And so those groups are coming together to talk about that, those topics, and then our research. But when you look at the themes across essentially this work done by 3 groups at a very similar period of time, there were common themes that run along that y-axis: equity, well-being, workforce. There was kind of that catch-all group of leadership, education, and technology, emergency response, and scope of practice for the profession. And so there's lots of conversations around what's happening with nursing, how is this impacting us? And in the innovation space, we're doing a lot of deep listening and trying to understand, where is the profession going? What is our role in the innovation space? How are we going to prepare nurses to lead into the future? What is nursing going to look like? And we're starting to, we're asking these questions, because this is where are nurses already leading and driving change that we may not know about. So during my doctoral studies, I traveled internationally, all over the United States, to study emerging kind of models after the Affordable Care Act passed, and then studied, internationally in different countries to learn about their healthcare systems. And one of the other kind of bodies of work that I picked up during that time was also the use of foresight and foresight tools. I did foresight work that, and now I'm a member of the Association of Professional Futurists. I do not call myself a futurist, but I use those tools in our work in the innovation space. And I use this AI database that searches all of these publications to essentially understand trends that are emerging in real time. And when you put in nursing into this, this AI database, we can look at what's happening and how are people, what is that public sentiment around our profession. Literally, as you could check it, moment by moment, day by day, week by week, whatever whatever frequency you would like. But a lot of the things that emerge, you can see how people are feeling about the profession. And this comes from professional journals, this comes from news articles, magazines, social media, and it gathers all of these different data points. And when you look at the sentiment globally around nursing. In the United States, right, nurses are incredibly frustrated right now. The sentiment around nursing is really, we're struggling, right? We're struggling as a profession. It is hard to be a nurse in the United States right now, and that's bubbling up in these scans. But when you look at the conversations around who's having conversations about nursing, it is pharmaceuticals, it is corporations, it is global consultancy groups, labor groups, right? Groups that you would expect. ANA always bubbles up in these search terms. Whether it's ANA or American Nurses Association, we're bubbling up as an organization, World Health Organization, US Labor, right, and Census. So again, lots of conversation around the profession of nursing. But then when you take all of those conversations and all of these data points, you do a SWOT analysis on that data. And when you look at where the SWOT analysis is pulling, we're seeing impacts for the profession around business, around medicine, around home care. And with that, it is the fact that all of this is happening right now. It's making it abundantly clear that the impact and value of our profession has huge impacts on the broader economy. And so when we think about where nursing is going, what is the work that nurses are going to do to get us into the future, that's our space in the innovation space, right? And we want to highlight nurses who are leading positive change. They're not stuck. They're trying new things. And it actually brings me to this William Gibson quote, right? The future is already here. It's just not evenly distributed. And one of the things that I found when I was traveling and crisscrossing the US is that there were some great innovations in, these little places that people, may not know about, but they were doing some really cool work. And that great work was known by maybe an organization or a department or a community, but nobody else did. So how do we shine a light on these great ideas? How do we make sure this great work doesn't get stuck in a single place? And so coming to work at the American Nurses Association to be able to lead this work on behalf of the profession is such an honor. And we have been working to kind of pull all of this information together in our resources for all of you on our website. It's nursingworld.org/innovation. And, I'm going to go through some of the content that you'll find on our website. But, the biggest thing that we have been doing massive outreach across the United States to the constituent state nurses associations, to organizations, to health systems. In the last year, given over 14 keynotes. We have, and again, our goal, and we create custom keynotes for every organization and group that we speak to. And it really speaks to the fact that we're listening, right? We are trying to understand what is happening so we can get ahead of, again, what are those opportunities for nurses and where can nurses use their unique knowledge and skills to really advance these conversations, advance health. And with that, the recognition, right? Nurses are human and providing nursing is a human experience. And nurses were innovating before the pandemic, but the speed of innovation increased, right? We saw that people were increasing faster over at the beginning of the pandemic because there were so many unknowns. So we had to adapt. We were trying to figure stuff out. But one of the trends that, we're starting to see is some organizations are still trying and still working to innovate and trying new things. But we're also seeing some resistance to change in this space, right? As some organizations and groups are trying to return to the way things used to be because that's known and it's familiar and it's comfortable, but it's actually not going to help us get into the future, right? It's not going to help us figure out how to navigate forward. And so when we think about, our work in this space, as we have been working with nurses, as we have been working with different groups, how powerful this work has been to really helping them advance their work. And, that ultimately design matters and how we engage nurses matter. We in the innovation are working to change how nurses see themselves, right? And how their work is portrayed, and the stories and words that are used to talk about the work that we lead as nurses, and sharing the innovative work of nurses across our profession. In the innovation space, we are this big amplifier of awesome work, right? And of nurses who are doing amazing things. And so, recognizing that every nurse is on their own journey, and how to help them advance their work wherever they are, and really creating space of content and community and network, and to really advance this work. So one way, when we think about the stories that people hear about nurses and that nurses are hearing about themselves, we launched a podcast in 2020, and it's called See You Now. And See You Now is a professionally produced podcast. We have received multiple awards. We won a Rock Health Storytelling Award. And I talk about the podcast not to say rah, hey, great, we have a podcast, but the fact that the podcast is, each of the episodes are stories about nurse innovators. And those individual episodes of nurse innovators have won digital health awards. They are the stories of nurse innovators. We are routinely in the top 20 or top 10 of health and wellness. These stories of nurse innovators are now crossing into consumer spaces. And with the podcast, we have great plans. We're actually, our latest numbers here just at the beginning of this year, kind of wrapping up 2022, over 1.4 million downloads and streams. And with that, our goal is to make this content interesting, and to help nurses find other nurse innovators to help lead and connect with, and maybe lead and guide your own work moving forward. So we are also the only nursing podcast that offers free CNE, and that free CNE, I'll drop the link in the chat for all of you so you can access it. But we've created customized bundles for, you listen to 4 podcasts and you get 4 CNEs. Like I said, we're the only only nursing podcast that does this. And our goal in this space, we're looking at offering additional bundles, but with these bundles, you can get 16 free CNE, and it's such a great offering. And again, right, if you're a podcast person, it's a win-win. And we also have an innovation award. The ANA Innovation Award is sponsored by Stryker. We have 6 categories for the Innovation Award. ANA was the first nursing organization to have an innovation award. And with that, I'm really proud. We wrapped up our 2023 application. We're about to announce that. We're going to be announcing that in March of this year. Would love to have you join that. And we are, when we talked to the nurses who applied for the Innovation Award, they said that our Innovation Award process, over 70% of the nurses who applied said that the process helped advance their work, right, and help them develop their ideas. And over 90% of our applicants said that they were very satisfied with the application process. So when you think about applying for something, for people to be very satisfied, we work to make this as easy for nurses to do as possible, because again, the applying isn't the important part. It's understanding who those nurses are and working to support those nurses moving forward. We also do innovation lounges. So if you want to, similar to what Emily said, grab a cup of coffee, grab a glass of wine, and come join us for one of our innovation lounges. Our innovation lounges are these places where we bring in these great nurses who are leading really cool work. What you see on the screen are 2023 innovation lounges. And this is where we get to engage, you get to engage with, hear the stories of nurses who are leading in new ways. In April, we are going to be talking about justice, equity, diversity, and inclusion. We have 3 amazing nurses who are doing really cool work in this space. And, looking at low income families, creating carbon credits to actually help them pay for other things. we have nurses who have launched social justice movements in their health systems, and that's just one, right? Like, and all of these panels have nurses who are just doing these super dynamic, this dynamic, amazing work. So come learn from them, ask them questions. We would love to have you be a part of those conversations. We are the Mobile Care Revolution. These are nurses who are actually from different parts of the country who are really focusing on, loading up, mobile vans, mobile trucks, and they are going into the community and how they're doing that work. One is not a vehicle model, but a community model that's really interesting. So again, I could go on about all of these, and but they're all incredible. And if you have a chance, please come and join. Think about joining one of our innovation lounges. Last year, we had nurses who work for the CDC, and they're actually epidemic intelligence officers, and all of like hearing about nurses who are doing and leading incredible work, but they're in atypical roles, right? And that all of these possibilities are open to nurses. And, I always say that nursing is the kind of best, worst kept secret, in the sense that, we have one, we get a nursing degree, but the hundreds of job opportunities and doors that can open because of that nursing degree, it's pretty incredible. We also do nurse pitch events. And again, this is a, kind of all a Shark Tank, where nurses, again, are able to bring their ideas, get feedback, and we worked to make sure that we cherry pick all of our judges and reviewers. And we are the only organization, when nurses engage with our innovation content, we give them the feedback, because the goal is to build and grow nurses, right? That this is not a black box. Our goal in the innovation space is to build and grow you and help you develop your ideas. Like Emily said, she is one of the individuals who sits on one of our 7 innovation advisory committees. We are right now working with our committees to look at our 2023 structure. And we open up the seats for these national advisory committees around innovation. And we do an open call when we do open call for the rest of the organizational committees. So watch for those opportunities. If there's an area that you're interested in, let us know, and we can, but also watch the open call for committee members, because that's where we those opportunities emerge. And the work of our committees, even in the last, what they were working on last year, we actually the committees created customized education around all 7 of our content areas. And so Emily's team, they created their own resource. So if you're interested in policy determinants of health, they have created this guidebook for nurses around resources and information that will help a nurse navigate that space. And this is true for all 7 of our committee areas. Our committees are working on kind of the final edits. So those are we're gonna put up a next edition of those already, hopefully within the next couple of months. But if you're looking for, ideas, spaces around innovation that you might be interested, you can check out our website, and we'll be sharing more about those resources moving forward. And then the other thing that we did a beta accelerator last year for nurses around innovation, and we expanded that. We formalized our accelerator in 2023. We opened that accelerator to ANA members interested in innovation. We opened it to nurses of color, nursing students, nurse educators, and then every nurse who applied to the Innovation Award, every nurse who applied to Nurse Pitch, where nurses were brave enough to step forward and share their ideas, they got the Willy Wonka golden ticket to come and be a part of the accelerator. And our accelerator launches in February. So we're really excited to get that kicked off. It is a free FREE 9-month accelerator, specifically and exclusively for nurses to be able to build and grow your work. And so lots more to come around the accelerator. But again, another resource or opportunity if it's something that you're interested in. We also, in 2023, are launching our innovation sandboxes, our innovation sandbox. And this is a micro funding. So maybe this is a really early idea that's not quite ready for, for the main stage, but a little bit of funding would help you get that idea moving. So this is open for nurses and nursing students. We're going to be giving away our first, and we are doing micro gifting of money. So this is money that we are just giving to nurses. And in the innovation space, when we think about how to help nurses move their idea forward, funding their work is incredibly important. And I'm really proud to say that by the end of this year, we will have given over $500,000 away to nurses in there, put that money into their hands. So again, something to be incredibly proud about. And we're also this year launching state-based or group-based innovation incubators. If this is something that you're maybe interested in as the IMD, something to consider. But again, happy to explore that with Emily Moore and Tina as that work moves forward. And then we also talked about community. So we in the innovation space and working with Tina and Brian and Shivangi and the membership group, we have worked to create a innovation membership community. We have over 11,000 nurses in that community. It is professionally moderated by an amazing nurse named Connie Dennis. And our innovation team is popping in and out of there as well. And, we have just this last week, we actually launched our first event for the innovation community where we're hosting conversations where people can come together. We call them Espresso Yourself, and where we can connect around different innovation topics. And, the community is a great place to start bouncing ideas, finding other nurses who are innovating. If you're interested in learning about innovation, think about joining this community that is free for you as an ANA member. So you guys I'm in my office right now. You can see my big wooden gear right up behind me. And the reason why I have this gear in my office, it actually came from an old mill. And it's a reminder that, gears work together to enhance each other and the power of each other. And in the innovation space, that's what we're looking to do. How do we enhance the power of nurses, of individual nurses, to be able to do greater work, to lead with greater power, and and moving into the future, right? Organizations and leaders and nurses who will differentiate themselves are those who can embrace change, can build upon the momentum. They're not stuck. They're trying new things, and the goal is that we can take all of this. All of these stressors and the anxiety and the frustration of what is happening in nursing, and really, transition that into urgent optimism, right? Because the future of healthcare, the future of our profession needs nurses and people who see what's possible, and they're willing to work to help us get there. And so another way to stay in touch with us or to keep up on our activities is sign up for our Gutsy Innovator newsletter. That's where we're sharing books, we're sharing quotes, we're sharing activities and things that are emerging, whether it's in the innovation community or you name it. You can find that content in our newsletter. And with that, if you're interested, we also do Gutsy. Let me see if I can grab some. I really have the best office ever because I get all the markers and the Play-Doh and all the Legos and all the fun stuff in my office. We do Gutsy Innovator stickers. And if you're interested in getting some stickers, send us an email at innovation@ana.org. We'll mail them to you, right? Because we're looking for nurses who are, courageous. They've got determination and the spirit to move this work forward. And when we look at the numbers of how innovation is shifting the conversation around our profession, our program is young. We are robustly moving this work forward, but we are going to keep growing this work and growing this, the capacity across our profession. So I can talk to you guys about this all day. I do custom speaking events for organizations. If we can help, if we can support you, you want to have a conversation with our team, reach out to us, right? Find us, and we will absolutely be in touch. But I'm really curious to hear about you. If you know of a nurse, if maybe that nurse is you, you're doing something that people need to know about, or there's some nurse who's doing some great work somewhere that people need to hear their story, reach out to us. We do a lot of share the mic spaces with nurses. We do blogs and articles on our website that are written by nurses about their stories and their work. And so come join us, be a part of this, this movement, this work, because healthcare and nursing is too important to stay stuck. And I'm just completely honored. Emily, thank you so much. And Tina and team, thank you so much for allowing me to be here with you. And tonight was a complete riot. And I love that we're in this space together. So thank you for everything you're doing.
Thank you, Ori.
Yeah.
I think we are going to quickly switch the slide deck back just because I have a
All yours.
couple
Yep.
of pieces to cover.
All yours.
Thank you. So thank you so much for being here. I can say from my own experience being part of the innovation work that ANA is doing, that Ori is leading, has really been just such a great experience. And I've enjoyed everyone that I've met in doing this work. And I'm so excited to see where this work goes in the future. So I realize that we are a couple of minutes over, but we definitely want to hear any feedback from anyone. So please feel free to put that in the chat or to come off mute. Just kind of any feedback about our meeting today. If you have any questions for Ori, if you want to know how you can get involved, go ahead, put those in the chat or come off mute. And I'm going to ask that we advance one slide just so you can see our calendar of what's coming up. So in case your question surrounds what is going on with the IMD in the upcoming months, this is what we have coming up. Look out, keep an eye in your email for our IMD elections. That notification will come out sometime in the spring. We don't have an exact date yet, but because we are spread out all over the place, email is how we are going to get to you. So make sure that the IMD chair at ana.org comes into your main inbox and doesn't go into your spam. So watch out for emails from there. We will have our notification for our elections coming, like I mentioned, sometime this spring. January 26th, again, that's our meeting today. Voting closes next Thursday, February 2nd. So again, the first probably email that you'll get from us after this meeting is about your voting instructions with your ballot. Of course, in May, we will celebrate National Nurses Week. Membership Assembly is occurring June 16th and 17th of this year. And our ANC Magnet and Pathway, that combined conference, I know many of us attend that, will be occurring in October 12th, and not listed here, that is Leadership Summit, which occurs in December. I see a couple of, I don't know, it's like magical. The chat is appearing on my screen. I see lots of thanks. Thanks for great to be with everyone. Thank you for a great introductory meeting. Thank you to everyone for joining. Thank you for hanging on as well as we went a little bit over time. We'll go, yep, just to the next slide. As I mentioned, this is our email, imdchair@ana.org. If you have any questions and you think of something after the meeting, please feel free to send an email to imdchair@ana.org. I am also available. Probably the easiest is on LinkedIn. You can find me there, and in my tag, it does say ANA IMD Chair. So in case there's anyone else with the name Emily Rocha, which I don't think there are very many of us, you'll know you got me because it has the ANA IMD Chair in my tag as well. So please feel free to reach out to me there on LinkedIn. And with that, I hope you all have a wonderful evening. thank you for joining. Please consider continuing to be involved in ANA. There's lots of opportunities to be involved, and we will see you soon. So thank you.